We're going to do a little bit about hormesis, recognizing that hormesis is a stimulatory effect of a low dose of a substance that is toxic at a higher dose. This sounds a little bit contradictory, but we'll see that it is contradictory. Oftentimes, the hormetic effect is described as giving a U-shaped or J-shaped curve, where if you look at these couple graphs, we'll see that at low dose, a particular molecule might give a stimulatory effect on a higher dose, an inhibitory, or if we look at the opposite side, we see a low dose decreases negative effects, a high dose induces the negative effects. Back in 1972, an allergist in Mobile, Alabama, wrote a paper in the Journal of Medicine for Alabama reporting a very rapid relief of flu symptoms by using the flu vaccine itself in a sub-vaccine dose. He did this by intradermal injection of the flu vaccine and reported a decrease in symptoms within 5 to 6 minutes after the introduction of the vaccine. In 1979, he published another little paper saying that the same sort of sub-vaccine dose of the flu vaccine also worked on herpes infections with people that had active viral infection. In his reports, Dr. Miller noted a couple things. One is he was insistent on using the current year's vaccine for treating the current year's disease, whether flu or herpes. However, as a bit of a contradiction to that, he had the impression that some vaccines, some year's vaccines, were a little more potent than others. So he would keep those in reserve in case he had a recalcitrant patient that didn't respond as he would have anticipated. Also of interest is that he reported no success in using this flu vaccine for treating any other kind of viral infection. So a few years later, Dr. Miller invited me to come down and see his practice for a few days, interview some of the patients, review his data, make some procedure, or observe his procedures. And I came away with a few questions that he wasn't able to answer. First one, the obvious one, and making the assumption, which is, by the way, valid, his observations were valid, that he was seeing these rapid responses in these patients with herpes or flu infections. Why only those two families of viruses responded? And what's the common denominator between those two? They are quite unlike one another in the sense that herpes viruses are double-stranded DNA. The influenza viruses are single-stranded RNA. Of course, the influenza is pretty much restricted to the respiratory tract. Herpes goes here, there, and everywhere. So what kind of common denominator do we have? And what in the vaccine is doing the work? That was really the fundamental question for me. The kind of a sub-theme was, why is he insistent on this year-to-year difference in the potency of the respective influenza vaccines? We went back to our labs in New York and in Providence, Rhode Island, did some collaborative work with the people at the City of Hope, and what we did was tear apart the viruses that are in the flu vaccine. We looked at the RNA core, the various coat proteins. We looked at the H and N. You'll remember that H1N1 just stands for hemagglutinin and neuraminidase. That's the H and the N. And different years' vaccines have different H's and N's. And we looked at these various components of the viruses that were in the vaccines and found that really, when we evaluated them both in vivo and in vitro, nothing happened. They didn't do anything at all. So that brings us back to the question of, why would 1 year's flu vaccine work on another year's cases? You'll recall that Dr. Miller kept some of the really hot stuff for recalcitrant cases, and yet we know that each year's flu vaccine is different than every other year's, in anticipation of whatever strain of flu is thought to be going to cause the problem that year. What's common to each year's vaccine? The preservative is the answer. It had nothing to do with what we thought was the active agent. It was instead the preservative, which is Thimerosal. Now, Thimerosal, you know, has a bit of a clouded history recently. That's the formula for it there, and you can see an HG in there, That's a mercury-containing preservative. It was used in vaccines for years and years. We just abbreviate it TML because it's easier to say. It's a very well-studied toxin. It's a potent anti-microbial and antifungal agent. We know it's used in mercurochrome, merthiolate. And it's a classic example in our hands of hormesis, or an hormesis exhibiting molecule, because in low doses, we see a very positive response with respect to some diseases. A high dose, nothing but trouble. It's not hard to figure out what the concentration of thimerosal is in the vaccines. It's about 50 milligrams per dose. We found a universal dose of thimerosal to be about 250 times less concentrated. The key here, other than concentration, is that term universal dose, because this is a classic universal dose. What that means is the dose is constant for every patient, regardless of mass of the patient's age, their gender, the degree of affliction, and even what species they are. Here's an idea of where we used a universal dose in all of these. The first one, cows get herpes infections. Malignant catarrhal fever is a almost universally fatal disease in cattle that's transmitted from sheep to cows. We did the work here at Colorado State at the veterinary school there and showed that we could reverse that disease. Mammalitis, another infection of cows. Run down through these real quickly, but the point is, whether it's equine herpes or the keratitis in cats, which is an eye infection, rabbit pox, looks like it ought to be a pox virus, but it's really a herpes, and all these human herpes infections, simplex 1 and 2, Epstein-Barr virus is a causative agent for infectious mononucleosis, and some people report that it might be associated with some kinds of cancers. Again, going back to Dr. Bauer's presentation, CMV is cytomegalovirus. There are more and more epidemiological information to show that that's a causative agent for hypertension and for some cardiovascular diseases, and about 98% of this population, our US population, has that virus. Herpes zoster causes chickenpox and shingles, and herpes also is responsible for many cases of Bell's palsy. The point of this slide is that the same dose is used whether it's on a 2,000-pound cow, a 6-pound cat, or a 150-pound human. It's the same dose, same response time, same effect. And it's also true for all the influenzas, but only, interestingly enough, for the true flus. The true flus are called influenzas A and B. These are the ones that give the nasty flu symptoms, the muscle weakness, the lethargy, the stuff that's going to knock you out for 7 to 10 days. In the paraflus, which are the 24-hour flus, the thimerosal has no effect at all. So that's kind of an interesting twist to things also. So we wanted to know what's happening. How is the TML working? And we've done some genetics work, genomics work in our own lab, and we found, and I know nobody wants to keep track of these different genes, but just to let you know, that we have upregulation of some genes like the IF-16, CCL5. These are potent anti-inflammatory or related genes. We have downregulation of interleukins 1B and 6, tumor necrosis factor alpha, interferon gamma. Those are pro-inflammatory, so if they're downregulated, there's less of an inflammatory response. And interestingly enough, when we deliver the thimerosal in the universal dose to a person that has a mouthful, for example, of herpes lesions, within a matter of minutes, that pain is gone. It goes just that quickly. This is because of the upregulation of the anti-inflammatories, the downregulation of the pro-inflammatories. This polar 2A gene is especially important in determining mechanism of action because it's responsible in part for reading the genetic code of the infecting virus. So if that's downregulated, the virus cannot replicate with the degree of efficiency it might have before. As a consequence of that, what we see is an inability of an infectious agent to replicate. That is to say, even in the face of TML therapy, the virus can get into the susceptible cell. It becomes uncoated. New virus components can be made, but they can't be reassembled. So that's the end of infection. And again, this happens extremely quickly. Just as an example or two, with EBV, EBV, the Epstein-Barr virus, and mononucleosis, it's not uncommon for college students, for example, especially if they're college athletes, to lose a semester of athletic activity because of infectious mono. If we see a patient with mono, start to treat them, they might lose 1 or even 2 practices, and that's it. They're back in operation. Likewise, with a herpes infection, for example, of some women will get a herpes on the lip that will predate the onset of the menstrual cycle. And they'll know that 2 or 3 days before the menstrual cycle begins, there's going to be this lesion on the lip. If that woman takes a drop of the universal dose of thimerosal under her tongue, a sublingual dose, every 15 minutes for an hour, usually by the second drop, there'll be no tingling or numbness sensation that she would have in her lip. The lesion will never develop, and that's the end of that. So this is a really remarkable way to control the disease. So what are we going to do about it? Well, again, getting back to Dr. Bauer's presentation, we're going to do clinical trials. And in fact, we're in the process of that. We have what's called an open IND for influenza. It was timed exactly terribly. We had permission from the FDA to do a trial right at the time of the last big scare with the swine flu or the bird flu a couple or 3 seasons ago. Just as that was winding down, we got permission to gear up. And since then, there hasn't been any flu to speak of. So that just sits on the shelf doing nothing. In opposition to that, we also have permission from the FDA to do what's called a phase 2 study with patients who suffer herpes infections following a dental procedure. That is an ongoing trial. We have patients enrolled, several sites, upstate New York in a private practice. Then we have 3 dental schools involved at Buffalo, Kentucky, and Pittsburgh. That trial is anticipated to be finished this summer. And it's a blinded trial, so we don't know the results. But from anecdotal work with hundreds and hundreds of patients over the years, we expect a positive result. So, conclusions to all this are these. Thimerosal is certainly in our hands and in the hands of physicians and veterinarians we've worked with for years, a very potent inhibitor of both influenzas, true influenzas, and all the herpes viruses, all of them, without exception. It's safe. Again, at these concentrations, recognizing that in higher concentrations it's anything but safe. It's incredibly inexpensive. It's easily administered. Just another hint, we talked about sublingual administration in humans, just a drop under the tongue. We do that also with dogs and cats. Owners seem to like that. For the larger animals like cows and horses, the same dose is given by sub-Q injection, get the same results in the same amount of time. So we look at thimerosal, TML, as a classic example of hormesis, where a toxin at high concentrations, given at the proper low concentration, can be a very useful therapeutic agent. That's it. Thank you.
Yes, John, I'd like to ask you, you talked about the dosage in different animals of different, yes, okay, thank you. Yes, Carl Medvedev. So my question to you, John, is have you tried dosages based on mass for different animals? So changing the dose by mass, and what, if any, difference was there in response?
Yes, we have done that, and we see the exact thing I mentioned on the U-shape or J-shape curve. Higher dose, we can get a negative effect or no effect. Lower dose, also a negative effect. So mass just plain has nothing to do with it.
Hi, John. My name's Emery Mort. Thank you for your presentation. My question is, in terms of a mechanistic understanding of why a low dose works the same on different size mammals, have you considered Rupert Sheldrake's morphic field theory, and that perhaps the medicine is hitting like a trigger unit that sets off a cascade of, okay, you're shaking your head, so.
That's exactly what's happening.
Okay.
The medicine.
Is that okay?
The medicine is simply acting as a signal. And that's why, interestingly enough, you can get the same response with the same dose given sublingually or subcutaneously. So once the trigger is pulled, that cascade occurs that results in the desired outcome. But that's all it's doing.
Thank you. And my second question is, have you observed or researched a decline effect in the application of?
No, we've never seen that.
Hi, York Dobbins, and I'd like to ask whether the description you just gave of hormesis is perhaps getting things a little bit turned around, since it, as far as I know, almost anything is toxic in sufficiently large concentrations. So it doesn't seem to be any surprise that a lot of toxins are harmless or even beneficial in very low doses.
I have no argument or anything about that. The point of the matter is that what might have been avoided because of toxic consequences can be utilized as a decent therapeutic agent in these low doses. That's the only point. I think from a practical standpoint, and some really nice epidemiological work that's been coming out in the last few years shows that we all know, for example, that radiation has some pretty serious adverse effects. There have been enough people retiring from careers in the radiation industry now as a result of simple aging, as you might think that those people that have been exposed to relatively small amounts of radiation day in and day out for years would have a higher incidence of certain kinds of cancer and especially leukemias. And just the opposite is true. The epidemiological evidence now shows that those people actually have a lower incidence than Joe and Mary on the street. So the fact that what you're saying is not terribly revolutionary other than for making it useful. That's the only point.
Bob Patterson. I'm sort of curious, how are you going to make money on this? I assume it might not be proprietary, and after other discussions, how is you as a commercial enterprise going to be making profit?
It is proprietary, and it is patented, and we will be the mercenaries like other people and license it out to the big pharma companies so they can rape the public and everybody makes money.
Good morning. What's the mode of excretion on all the different animals of the mercury?
Some is breathed off, other goes out through the feces. This is ethyl mercury, not methyl, so it's less toxic in a sense. And in fact, we have patients, mostly human, that have been on the sublingual drops of this substance for years without interruption, and we can't find anything in the way of toxicity.
Hi, Christine Hart. Any effect on post-herpetic neuralgia?
You bet. Yes, we combine it with one other molecule, and we can pretty well take care of that. Mm-hmm.
Hi, John. I'm Kenny Arnett. I'm wondering, first of all, what your take on the debate over autism and Thimerosal is, and secondly, what's the relationship between your work and homeopathy?
Okay. The first one with respect to autism, we've done quite a little bit of work with that disease ourselves. You're familiar with the epidemiology that's been done in the last 3 or 4 years that strongly suggests that mercury, or at least thimerosal, is not a causative agent of autism. That doesn't mean it's not in the minds of a lot of people. But what we have found is this. Autism is certainly a multifactorial disease. Just to give you an example, we have one family in Sacramento who had a 3 or 4-year-old daughter who developed autism about 2 weeks after being vaccinated. And so, the antenna go up and there's a problem, and that child has become, frankly, autistic, institutionalized, and so forth. They had a younger son who, because of the parents' knowledge and aggressiveness in learning about autism, decided not to vaccinate the boy. When he got to be 3 years old, he became autistic also, without any vaccine. So that's one part of it. I think very strongly that vaccines have something to do with some cases of autism, but it has nothing to do with the preservative. It has to do with multiple vaccines simultaneously in a child that is immunologically incompetent. And the consequence of that can be autism. Just to mention one more thing about autism, and that is kind of a strange case, but very interesting. There are some parents with autistic children who, at the time of meltdown, or some of them talk about meltdown, some talk about the kids being on the ceiling or so forth, the way they bring them back to semi-normalcy is with a drop of TML. Yeah. The second part of your question had to do with homeopathy. And we distinguish what we're doing from homeopathy according to a couple or three parameters. One is our concentrations are a great deal higher than would be normally found in a homeopathic dose. We do go through FDA studies. That's what these trials are about that I talked about in the last portion of the presentation. In order to go through those trials, you have to be able to detect the material in the vial, which is pretty hard to do in some homeopathic remedies. That's one change. Second change is we don't do anything with succussion. That doesn't do anything for our stuff one way or another, and that seems to be integral to successful homeopathic remedy formulation. Third thing is that although you can buy homeopathic remedies off the shelf, a homeopathic physician will take 10 people with herpes, for example, and if he sees each patient, he'll send them home with 10 different formulations because of their background, the multifactorial aspects and so forth. We don't do that. That's why we're all excited about universal doses. If you can have one dose that treats the veterinary patient as well as the human patient, that's a big deal, and that, again, is a bit inconsistent with the autistic situation, the homeopathic situation.
Hi, again, I'm Emery. My question is, have you tried the universal dose on non-mammals?
No, and I'm trying to think of any that, what's the non-mammal you're thinking of that has a herpes infection? We're trying to treat diseases, so if they don't have a herpes infection, we wouldn't be treating them. I simply can't think of a fish flu or certainly bird flu, but the birds don't suffer. No, to answer your question, we have not.
Thank you, John.
Okay, thank you.